You've probably heard this thousands of times. After 60, get every test done, don't skip any appointments. Prevention is better than cure. And in most situations, that's absolutely right. But what almost nobody tells you is that some specific screenings, at this age, can do you more harm than good. I'm not making this up. This is documented in serious scientific studies, published by the world's most respected health institutions. And today, I'm going to show you 5 of them. But before we continue, I need to ask you something. Do you have someone close to you who is over 60? A father, a mother, a grandfather, a grandmother, a dear friend? If so, share this video right now, not later, now. Because this information can make a real difference in the life of someone you love. It can prevent an unnecessary procedure. It can spare someone months of anxiety, invasive tests, and treatments that should never have happened. And it can even save a life, not by doing more tests, but by doing the right tests at the right time for the right person. I'm Dr. David Volds, and here on the Body Reset After 50 channel, we talk about what really happens to the body after 50, with honesty, with science, and without sensationalism, because you deserve quality information, not unnecessary fears, not generic protocols that ignore who you really are, but real understanding of your body, your health, your life. And today, that understanding can change the way you see your medical care forever. You know what deeply concerns me after years of caring for patients? It's not the lack of tests. It's the lack of conversation. It's the doctor who has 10 minutes per patient and can't explain the pros and cons of each decision. It's the patient who leaves the appointment with a stack of test orders in hand without understanding why they're doing each one. It's a system that treats a 72-year-old man the same way it treats a 45-year-old. And that lack of individualization has real consequences. Consequences that affect lives, that generate unnecessary suffering, that sometimes, and this is hard to say but it needs to be said, do more harm than good. Let's begin. And before I present the 5 screenings, I want you to remember one phrase. There is no such thing as a bad test in itself. What exists is the wrong test, done on the wrong person at the wrong time. That distinction changes everything, because when you understand that, you stop following protocols blindly, and you start asking the right questions, the questions that can truly protect your health. The first screening, the PSA test. The PSA test is one of the best-known screenings in men's preventive medicine. It's a simple blood test that measures a protein produced by the prostate gland. Seems harmless, right? On the surface, yes. But the problem doesn't lie in the test itself. The problem starts with what happens next. Let me explain. When the PSA result comes back abnormal, it triggers a series of events that can completely change a man's life, even when there was nothing wrong to begin with. Between 20% and 50% of prostate cancers detected by this test are cases of overdiagnosis. What does that mean in practice? It means these are tumors that would never cause any symptoms during the patient's lifetime. Tumors that exist, yes, but that would never grow, never spread, never cause any problem whatsoever. The man would live his life normally, never knowing he had that tumor, and would die of something completely different decades later without ever having suffered because of it. But because the test detected it, treatment begins. And treatment brings serious consequences. About 1 in every 5 men who undergo surgery to remove the prostate lose bladder control. That means urinary incontinence, diapers, limitations, a deep impact on quality of life and self-esteem, and approximately 2 in every 3 develop erectile dysfunction. That is not a minor side effect. For many men, it represents a devastating change in their intimate life and emotional well-being. On top of that, the test generates a high number of false positives. About 6% to 7% of men receive an abnormal result without actually having cancer, and only 25% of those who have a biopsy due to an elevated PSA level are actually found to have the disease. That means the vast majority go through an invasive, painful, and frightening procedure, with no need whatsoever. For all these reasons, for men aged 70 and older, the leading international medical guidelines recommend against routine PSA screening. The risk of false positives, biopsy complications, and treatment-related harms outweighs the potential benefits. This doesn't mean you should ignore prostate health. It means the decision to have this test or not should be an honest, individualized conversation with your doctor, taking into account your age, your history, your health conditions, and your personal preferences. Not an automatic protocol applied to everyone the same way. And there's something very few people know about PSA. PSA levels can rise for completely benign reasons. A simple urinary infection can raise PSA levels. Sexual activity in the 48 hours before the test can raise PSA levels. Even riding a bicycle can raise PSA levels. That means an abnormal result is not synonymous with cancer. Far from it. But for many men, receiving that abnormal result feels like receiving a sentence. Fear takes over. Sleepless nights begin. And a cascade of procedures starts, often automatically, without proper reflection on whether it's really necessary. That's why information is so powerful. When you understand what the test really means and what it doesn't mean, you can actively participate in the decision about what to do next. And that active participation is not just your right, it's a responsibility to yourself, to your body, to your life. No doctor in the world knows your body as well as you do. And no generic protocol can replace an honest conversation between you and the professional who cares for you. The second screening, colonoscopy, after age 75. Hold on. I'm not saying colonoscopies are bad, quite the opposite. For people between 45 and 75, colonoscopies save lives. That's proven. The point here is the age range. After age 85, experts advise against routine colonoscopies because the risk of complications may outweigh the benefits of screening. And between 76 and 85, the recommendation is that each case be assessed individually, with great care. And there's a very clear reason for that. The overall risk of post-colonoscopy complications is twice as high in patients aged 75 and older compared to patients between 50 and 74. Twice as high. This includes the risk of intestinal perforation, bleeding, and cardiopulmonary complications. And there's more. Patients aged 65 and older have a 30% higher risk of intestinal perforation, which is the most serious complication of the procedure. An intestinal perforation is not something simple to treat. It's a surgical emergency, with risks of serious infection, prolonged hospitalization, and a serious impact on recovery. And the more health conditions a person has, high blood pressure, heart problems, kidney disease, the greater that risk becomes. For someone in that situation, with multiple illnesses, a colonoscopy can become a threat rather than a protection. Think about that for a moment. The person goes to get a test to protect themselves and ends up facing a complication that puts their life at risk. This happens. Not rarely. And that's why modern medicine is revisiting these recommendations with much more care and attention to age and the individual conditions of each patient. And there's something nobody talks about regarding colonoscopy preparation. The bowel prep, that intestinal cleansing process done the day before, can be extremely stressful for an elderly person's body. The dehydration caused by the prep can trigger cardiac and renal complications in people with pre-existing conditions. The sedation required for the procedure also carries risks that increase with age and the presence of other illnesses, and recovery after the exam can be significantly longer and more difficult than most people imagine. This doesn't mean colonoscopy is always wrong for people over 75. It means the decision needs to be made with much more care than simply following a routine protocol. The third screening, mammography after age 75. Just like colonoscopy, mammography is essential in other age groups. For women between 40 and 74, studies show a real reduction in the risk of dying from breast cancer. But above 75, the picture changes completely, and that surprises many people. There is no randomized clinical trial that has included women aged 75 or older. That means we have no direct scientific evidence on the benefits or risks of mammography in this age group. What we have are modeling studies, and they point to something concerning. 47% of breast cancer diagnoses in women between 75 and 84 represent overdiagnosis, nearly half. That means cancers that would likely never have caused symptoms or health problems, but that were detected and treated. Nearly half of these women go through surgery, radiation, or chemotherapy with no real need. And the treatment itself, at this age, carries serious risks of functional decline. The body of a 78-year-old woman responds in a completely different way to treatment than that of a 55-year-old woman. Recovery is harder. Side effects are more intense. The impact on quality of life can be devastating. The issue isn't about ignoring breast cancer. It's about understanding that the screening itself can cause more harm than good depending on the person's overall health. And this is a conversation that deserves to happen, with information, with respect, and without judgment. And there's an emotional dimension to this discussion that is rarely addressed. Imagine a 79-year-old woman. She raised her children. She watched her grandchildren be born. She built an entire life. She goes to a routine appointment, has a mammogram, and receives a suspicious result. Suddenly, her life changes. Fear of cancer occupies her every thought. She spends weeks waiting for more tests. She has a biopsy. She faces the process alone or accompanied by worried children who reorganize their lives to be by her side. And in the end, it was overdiagnosis. A tumor that would never have caused any problem, that she never would have known existed. That would have let her live her remaining years with peace, with quality, with presence. But now she knows. And that knowledge has a cost. Emotional, relational, existential. That matters. Medicine needs to consider not just the years of life, but the quality of those years. The fourth screening. Low-dose CT scan for lung cancer. This test is recommended for long-term smokers between the ages of 50 and 80. The problem starts when it's done on people who don't fit that profile, or when it's done without proper guidance about what can happen next. CT scans frequently detect nodules in other organs beyond the lungs, such as the thyroid, for example, triggering a cascade of additional tests, biopsies, and unnecessary interventions. And that comes at an enormous cost, not just financial, but emotional. The anxiety of receiving a suspicious result is paralyzing. The wait for follow-up tests is agonizing. And many times, at the end of that entire journey, it turns out there was nothing worrying at all, that it was a false positive, that all that suffering was unnecessary. On top of that, false positive rates are high, and every suspicious result creates a cycle of anxiety, more tests, and invasive procedures. Statistical models indicate that screening beyond age 80 is not recommended due to increased operative mortality, greater comorbidity burden, and reduced eligibility for surgery with curative intent. In other words, even if the scan finds something, the surgery to treat it may be more dangerous than the tumor itself. This needs to be weighed very carefully, with great respect for each person's life story, and with an honest conversation between doctor and patient about what truly makes sense at that specific moment. And I want to tell you something about what happens after a false positive. Research shows that people who receive a suspicious result on a CT scan, even when it's later confirmed to be a false positive, continue to show elevated levels of anxiety for months, sometimes for years. The fear doesn't disappear when the negative result arrives. It leaves a mark, a distrust of one's own body, a hypervigilance that drains energy and undermines quality of life, and this needs to be weighed in the balance when we decide whether or not to have a test. The benefits need to outweigh not just the physical risks, but also the emotional and psychological risks. The fifth screening. Cervical cancer screening after age 65. This is perhaps the least known of the five, and the one that surprises people the most when they find out. Most women don't know this, but after age 65, the recommendation is to stop pap smears and HPV tests, as long as the woman has had 3 consecutive negative pap results or 2 consecutive negative HPV results in the last 10 years. Continuing these screenings beyond that point without indication, exposes women to false positives that lead to biopsies, unnecessary treatments, and considerable emotional stress, with no proven benefit. Let that sink in for a moment. A 68-year-old woman who has always taken care of her health, who has never had any concerning result, who has done all her tests correctly throughout her life, goes to the doctor for another routine pap smear. The result comes back abnormal. She spends weeks in fear, in anxiety, with a heavy heart. She has a biopsy, and in the end, she finds out it was a false positive, that there was nothing there, that all that suffering was unnecessary. This happens far more often than we imagine. An indiscriminate screening can cause more harm than the very disease it's meant to detect. And here's something even more important about this topic. Many women feel that stopping their pap smear is like abandoning care for their own health, as if it were a surrender, as if they were giving up on themselves. But that's not what it is. Stopping a screening that no longer brings benefit, and that can cause harm, is an intelligent, evidence-based medical decision. It's respecting your own body. It's recognizing that precision medicine treats each person as unique, and that taking good care of yourself at this stage of life means making the right choices, not necessarily doing more. What to do with all of this? Now, before we wrap up, I need to make one thing very clear. None of these 5 points is an invitation to abandon your healthcare. Quite the opposite. What science shows is that precision medicine, the kind that evaluates each person individually, considering age, medical history, comorbidities, and life expectancy, is far more effective than following generic protocols applied to everyone the same way. Because you are not a statistic. You are a person, with a unique story, with a unique body, with health conditions that belong to you and no one else. And the decisions about your medical care should reflect that. The decision to undergo a screening test should always take into account the individual's life expectancy, personal preferences, and the real balance between benefits and risks. Not what was done for a different person, in a different situation, in a study conducted decades ago. Think about how many people you know who had a routine test, received a frightening result, spent weeks in suffering, and in the end, found out everything was normal. That suffering has a name, it has a cost, and many times it is completely avoidable. I'm not saying tests are enemies, I'm saying tests are tools, and like every tool, they need to be used at the right time, by the right person, with the right guidance. A hammer is an excellent tool, but you don't use a hammer to tighten a screw. In the same way, a test that's excellent for a 50-year-old may be unnecessary, or even harmful, for an 80-year-old. That is precision medicine. That is the future of healthcare. And you can start living that future today by asking the right questions to your doctor. And now, what can you do? If you are over 60 or have someone close to you in that age range, the advice is simple, but powerful. Before any routine screening, ask your doctor one question, a direct question, an honest question. What is the real benefit of this specific test for my particular situation? Not for a generic 60-year-old patient, for you. Considering your age, your history, your health conditions, your values, what you want for your life. Because that answer may be completely different from what you imagine, and it can change the way you take care of yourself forever. If your doctor doesn't have the time or willingness to answer that question carefully, maybe it's time to seek a second opinion. I'm not saying this to create distrust in medicine. I'm saying it because you deserve to be heard. You deserve to have your questions answered. You deserve care that respects who you are, not just the number of your age or the items on a checklist. Modern medicine is evolving. We are learning that more is not always better, that doing more tests, treating more, intervening more, doesn't always lead to a longer or healthier life. Sometimes, the wisest choice is knowing when not to act, when to observe, when to trust the body, when to accept that some findings don't need treatment, and that takes courage. It takes maturity. It takes an honest conversation with your doctor and with yourself. Before we close, I know this kind of information can raise doubts. It can cause discomfort, maybe even a little fear, After all, we were raised with the idea that the more tests, the better, that prevention always saves lives. And in many cases, that's true. But intelligent prevention, the kind based on evidence, individualized, respectful of each person's stage of life, is even more powerful. And that's what I want for you. I don't want you to do less. I want you to do better, with more awareness, with more information, with more active participation in decisions about your own health. Because in the end, nobody knows your body better than you do, and nobody has more to gain from the right decisions than you. If this video opened your mind in any way, leave a comment below sharing your thoughts. Or if you've ever been through a similar situation, a test that generated more anxiety than answers, a result that scared you but turned out to be nothing, a treatment you wonder if was really necessary. Your story matters, and it can help someone else who is watching right now, in silence, recognizing themselves in every word. Share this video with someone who needs to see it. With that person who is about to have a routine test without questioning whether it really makes sense for them. With that person who follows protocols without asking why. Sometimes information arrives at exactly the right time, and it can change the course of a life. If you want more content like this, honest, grounded in real science, and focused on what truly matters for those over 50, subscribe to the Body Reset After 50 channel and turn on notifications. Because every week we bring information that traditional medicine rarely discusses. Not to scare you, not to confuse you, but to illuminate, so that you can make more conscious decisions about your body, your health, and your life. You deserve to understand what is happening inside you. You deserve to actively participate in decisions about your health. And you deserve to live well, not just longer, but with more quality, more awareness, and more dignity. I am Dr. David Volds. See you in the next video. Take care of yourself, and always remember, health is not about doing more. It's about doing it right. For you, for your body, for your life. See you in the next video.